Hello, I'm Sebastian, a perioperative medicine fellow at UCLH, and I'll be presenting on improving the NELA case ascertainment at University College Hospital through a quality improvement initiative. NELA is a national clinical audit that collects and compares data on emergency laparotomy care and outcomes across UK. Case ascertainment is fundamental to which all NELA principal standard data are derived from, and a poor rate affects perioperative benchmarking, quality improvement, and governance. At baseline, case ascertainment at UCH has been below the benchmark target of 85%. We performed a 6-month retrospective audit and identified eligible cases that were missing from the NELA database. Thus, a quality improvement project was initiated with the aim to increase the case ascertainment to above 85% within 3 months. Using the Model for Improvement framework, we first mapped our workflow process. While analyzing the root cause, we realized that case identification was heavily reliant on the Electronic Health Records Workbench report. Upon further review, we found that half of missing cases failed to be identified by the report due to flaws in reporting process related to procedure coding errors and imprecise search criteria. On the contrary, the remaining half of missing cases were identified by the report but were not submitted. This omission of eligible cases stemmed from knowledge gaps and out-of-hours workflow process deficiency. Through iterative plan, do, study, act cycles, we tested and subsequently refined several interventions. To address the workbench report flaws, we introduced prospective daily theatre list screening, as retrospective search reports alone were thought to be insufficient for reliable case identification. Errors with procedure codes were rectified, and the search criteria was streamlined to avoid redundant results. To ensure inclusion of all eligible cases, education and training sessions were conducted, and weekly reminders on workflow process were distributed. We then analyzed our data, with the primary outcome measure being the UCH NELA case ascertainment. Several process measures were also identified to evaluate the efficiency of the improved workflow process and the EHR workbench reports. Results revealed an improvement in case ascertainment, with values rising above the benchmark target. Additionally, case ascertainment was above 100%, indicating that the number of true cases exceeded the algorithm-derived expected case numbers. All process measures showed improvements of between 10 to 24%. In conclusion, the aim of this quality improvement project was achieved using the Model for Improvement framework. This reliable case ascertainment is foundational to emergency laparotomy patient outcomes. Thank you.